One of the first things you learn in medical school is a Latin phrase that loosely translated means, first of all, do no harm. People come to us asking for help. So their first priority is, first of all, protect me from harm. Secondly is heal me. It certainly makes sense. People are coming with an injury, an illness, a disease that they want help, they want treatment for. Third, treat me with respect. It's very important to treat patients with dignity and respect. I think that's really important. That's part of our culture. It's a big deal. When you review doctors and nurses and other providers, one of the things we try to get is a cultural fit. Do they fit into the Cook culture? That we treat families and patients with dignity and respect, and we treat each other in the same way. Fourth is provide me with the right care at the right time and in the right place or the right setting. And then lastly, they want help in making their community healthy. You know, our goal is to be the healthiest place to raise a child in the country. And we can't do that by ourselves. We have to collaborate with the school systems and with the mental health providers and with the other agencies in our region in order to do that. And they're asking us to help them in that way. And we think that's very important as well. So Zero Harm is a quality initiative. In simple terms, it means that our goal is to never harm a child in the course of therapy. And that sounds really simple, but it's very complex because medical care is very complex and things happen that can result in injury or harm to a child or a patient. We follow about 10 hospital-acquired conditions that we can benchmark with them. And at any given time, we often may lead anywhere from 2 to 4 of those that have the lowest rate in the country amongst all of those peers. And so I think we do very well. Does that mean we're perfect? No. Does that mean we have opportunity for improvement? Absolutely. A bundle is a collection of activities that you either do or shouldn't do that are known to result in a lower incidence of that complication. And so with each project, a collection of those activities or an improvement bundle is created, and then we roll those out to the various care areas in our institution. The units that achieve higher than the goal, which is generally 90–95%, get celebrated. They look at all aspects of our care. They'll look at our documentation, they'll look at our sterile processing, they'll look at our medication reconciliation, and make sure that we're doing it according to appropriate standards. One of the cool things for us has been, usually when we get accredited, they will usually say to us, well, we think this is the best practice. We think you should submit this to the Joint Commission. They may pull that out and say, well, look how Cook Children's does it. We thought that was the best practice. And so that's been kind of fun. So Leapfrog is a not-for-profit organization that bound together and said, we're going to advocate and advance safe patient care. They don't just come in and look, they actually test you. There are things that we call clinical practice guidelines that we have to answer in order to take care of that patient. And then we make that change, and then we get another baseline and we say, did we get better? If the answer is yes, then we continue doing that. If the answer is no, then we tweak it and we go to plan B. You know, our promise is to improve the health of every child in our region.